All right, good afternoon, everybody. Thank y'all for joining us for a special town hall meeting here on Friday at 3:30. Different day, different time, but unfortunately, same topic, which is our COVID within Springmore. As you know, we're not doing our weekly town halls anymore. We went to monthly with those, but as I said, we'll do a special town hall or send out a special memo if there's anything I feel that everyone needs to know. So last week I did send out an email or a memo rather of information I thought everybody needed to know, which was our recent cases in the health center and what we're doing to try to decrease that and things we've had to put in place to make that happen. So I sent that to all the families of the residents in the health center, and then I also wanted to send it to each of you so everybody's on the same page. As I've always said, I want to be as transparent as possible. Just please know that we do that. We may not be able to get this stuff out as quick as some may think. We do have 100 other issues going on, but we do get this stuff out just as fast as we can, and normally it's the day of, if not the next morning. We do put a memo in everybody's box, so sometimes the email is a delay, so everybody kind of sees it at the same time. But anyway, we did have some new cases, and a lot of independent residents were asking questions and had concerns, and I understand that, and we want to address those. It is hard to address, 30 and 40 different questions from independent residents when we're trying to focus on the actual residents and staff that are affected in the health center. So it's not that y'all are not as important, but as I said, try to refrain from going to Margot. She's dedicated to helping the residents that are affected in the health center and the staff. So in an effort to answer some questions and maybe clear up anything that y'all may want to know, Margot suggested we do a question and answer town hall, kind of a special day. So I asked everyone to submit questions that you'd like to know before, I believe, yesterday. So I think we've received 5 or 6 questions. Margot will answer some, and then I will answer some, and then we'll talk about a few other things as well. So I'm going to let Margot speak for a second. She's going to talk and give you a few reminders, and then we'll get into answering the questions. And then I want to talk about 2 other topics, and if there's any last-minute questions that you would like to ask, you can call 7054. Is that right? It's 52 or 54, 7054, but hold off until the very end of this. We're not going to be taking any calls until we go through all the questions. So, all right, Margot?
Hi, everybody. So I wanted to mention just a couple of things of what's currently going on in the health center as far as trying to prevent any more spread and any more positive cases. So currently, as far as testing, we're in what CMS and the state considers outbreak testing. So all the residents, all the staff are getting tested on a weekly basis. Additionally, if someone shows signs or symptoms in between those times, we also test those folks. Right now, we're still using Mako Laboratories. It takes about 48 hours turnaround time to get that information back through their portal, but they call me with any positives as soon as they have them. Currently, if anybody goes out to the hospital, brief emergency room visits are a case-by-case basis, but if someone has a hospital stay and they come back to the health center, they are quarantined for 14 days. They are tested along with the rest of the residents, and then they are tested finally on the 11th day right before they come off of quarantine to make sure that they're still clear. Residents that come in from Springmore are tested on admission and then weekly thereafter while they're here. As far as the isolation unit, and as you can tell from the report that gets posted, we have had quite a few more resident cases that was a little more than what our initial isolation unit could do. So our isolation unit has been extended. There is another area right above the current isolation unit that mirrors that, and so we've got 8 more beds available for that. The staff that is designated to work on the isolation unit come and go from a separate door. and they do not go into the health center. And the other thing that I wanted to mention, so just as in the news across our county, across our state, across the Midwest, cases are increasing. We've had many record days in the last week, probably than we did in the first surge, and I think this is that second wave that they talked about, and certainly what's happening in the health center is mirroring that. And I think it's in part due to a lot of different things, but I think that people need to keep in mind that just because phases are progressing and that things are opening, the threat of the virus isn't necessarily any less. So even more so now than when we were in full lockdown, washing your hands and maintaining that distance and keeping a mask on, all of those steps have shown to decrease the transmission and spread of the virus. So I think that's something to keep forefront in our mind. We did install over 50 hand sanitizer stations throughout independent living over the last several months, or this has been a couple of months now. So those are available right by the elevators. When you're at dining or waiting for anything, you know, trying to keep your distance, following each one of the recommendations significantly decreases the chance of contracting the virus should you come in contact with someone who is positive. The other thing to remember is when people talk about being exposed, you know, I was exposed to someone, try and keep in mind that a true exposure is spending that 15 minutes or more in someone's personal space in that six feet of distance without masks on. So for each of those variables that you can eliminate, you decrease your chances of contracting the virus. That's all I wanted to say starting out. Did you want me to do my questions and then you do yours?
Sure, yep, that'd be great.
Okay. So one of my questions states, the state registers the cases for nursing homes in North Carolina. Springmore, or more so Stewart Health Center, is listed, but it doesn't seem as though the Cypress Rosewood is listed. Does this mean they have had no cases and or no deaths, or are they listed under a different category? Facilities are listed under the type of congregate setting it is, so long-term care may be listed different than an assisted living facility, or if it's a combination facility, it may be listed with the skilled nursing facilities. Correctional institutions, care homes, small care homes, and rest homes and some of those places are listed separately. So if you're not seeing them on there, either they're in a different category, they have in fact had no cases, or they have had an outbreak and they've gone their 28 days and so they've been dropped from the list, which is one of our goals for the fall and winter. One thing I will say, and every time I check this, the data is very slow to update. I don't know what their process is. I know the CDC posts things on Mondays and Fridays, but I've never quite seen this accurately reflect what's going on here, so it makes me question basically some of the numbers in that, because that's dependent on the facilities reporting and then the people getting the information, getting it posted. So it could be for a number of reasons. What must an out-of-town guest that comes to visit via airline do to enter Springmore? Will they be quarantined? And Brandon and I talked about this at length. And with everything opening up the way it is, and with airlines doing all the checks that they're doing, we don't really see where quarantining would be of a benefit. If someone is flying here, then they're coming from a distance and their time here may be limited. And asking them to quarantine for 10 days or 2 weeks might just not be feasible. The fact of the matter is you can come in contact with someone who's come in contact with someone or lives with someone that's positive just about anywhere you go, whether it's the person you follow in the grocery line or the person that you follow at the gas pump or at the library. So out-of-town guests or having flown on an airplane doesn't necessarily make you a higher risk than anybody else. A lot of people ask about the rapid test. Now, if this is the same rapid test that they talked about, a few weeks ago when they were talking about nursing homes, get this, the rapid test has a 20% error rate. It's not quite as sensitive and accurate as the PCR testing, antigen testing that we do. Additionally, it's been shown to work better for people who are symptomatic and to rule in or out COVID versus just screening. So the rapid test isn't necessarily an answer. And really, the timing of exposure, the timing of testing, I get a lot of questions about this, and while there are some beliefs, there is no guarantee. If you get exposed to someone today, don't get tested today or tomorrow. You want to wait about 5 to 7 days. The virus has to get in your body and replicate and multiply and come to a level to where a swab test will trigger positive for it. So even testing somebody 3 days ago doesn't mean they haven't come in contact with somebody in the last 2 days. So as far as quarantining when you come to visit, no, we're not mandating quarantining when they come to visit. I would recommend not having overnight guests and minimizing your exposure to folks that you don't know where they've been or who they've been in contact with. I would continue to wear masks in your apartment when you're visiting. I know this is inconvenient, but it's definitely a safety move. I wear my mask when I visit my daughter. It's just an extra safety measure that I can take. Again, frequent hand hygiene, and studies have shown that the alcohol hand gel works actually better than soap and water for the coronavirus. So keep your hand sanitizer handy. And again, social distancing, such as, I have my mask off, but Brandon's way over there. And if you can sit in the periphery of your living room and talk versus right across the table or right next to somebody, that's just added benefit. So I hope that helps some of you. And I think I may have one more. Or no, I don't. All right. That's all for me.
All right, thanks, Margot. Yes, one of the things I want to follow in on before we go into my questions is there's an article today about CMS talking about holiday visitation, and just reminding everybody that the holidays, Thanksgiving and Christmas, are not time to let your guard down. Realize that you're going to see family and be around each other, but just really practice all those things that Margot just went over. You just got to be very careful of being mindful that if you're seeing family from different areas, to stay the 6 feet, wear your mask when you can, continue to sanitize your hands, wash your hands as much as you can, but just be mindful during the holidays that it's, that the virus doesn't take a day off. So Thanksgiving and Christmas is just like any other day. So just be mindful of that. We'll have some more, safety tips or best practices about holiday visitation for y'all to use. Again, you're independent living residents, and y'all can live y'all's life the way y'all want to, and that's the way I want it. We do have to implement things here at times that benefits everybody, but of course we want y'all to have as much freedom as possible, so we try to provide as much information for y'all to make those educated decisions. I believe that's the best way to do it, unless it's something that I've been mandated to implement here. So anyway, we'll have some more information about the CMS guidelines for holidays here soon. And 2 other things that Margot didn't mention, but she came up with, and we'll give her credit, and they're great ideas. She, early on during our first wave, we were trying to think of all the stuff we could do in-house to prevent the spread of the disease. We have a lot of tips and things that you hear that we can do, but what can we do within Springmore, within our specific environment, to help spread the virus, reduce the spread of virus? So we implemented a couple of things like, maximum people in certain rooms. We got that idea from the break rooms. We thought the break rooms were too crowded with staff, so we only allowed 2 staff members in each break room due to the square footage, and that's how we got the idea to do all the parlors and all the smaller rooms of a max amount of people based on square footage. So that's one thing we did. We've did a couple other things that I can't bring to mind right now, but another new thing that we started that Margot mentioned is that all the people working in the isolation unit are entering work and exiting work through a separate entrance that goes right into the isolation unit. So that will just, again, reduce the exposure of anyone that is working in that unit to spread it to other people. So that was one thing we did. Another thing that we're doing is the staff members that work in the isolation unit, they're not clocking in at the normal time clock. Their time is being entered in manually, so their bosses are entering their time in and their time out, so they don't have to touch or fill out any forms to make that happen for their time worked. And then lastly, we've created two more things. We've created a break room on the new isolation wing upstairs just for the people that are working the isolation unit. So again, keeping them all together, keeping them in their own separate environment so they're not exposed to anyone else. So a separate break room. And then lastly, they're not coming to any of the shift change meetings or any of the educational sessions that we're doing. They're going to have their own little group meetings and their own educational stuff if they need that. So again, just keeping them separate from the entire group. So there's a few other things that Margot implemented, which I thought was fantastic. So just wanted to share those with y'all, and those are something specific to Springmore. I'm not saying, another nursing home in California is not doing it, but it's something that we're doing here that's pretty neat that Margot came up with. So, all right, so I have 4 questions here to answer. 2 kind of pertain to the same issue, but I'll read the first one here. It's regards to testing. It says, it seems to me that Springmore ought to test all employees in the health center for COVID every week, regardless of whether it is required. The testing could be done here at Springmore or at one of the COVID testing sites off campus. Has Springmore considered testing all employees in the health center every week until a vaccine can be given to all? It seems that the transmission of the virus comes from the employees working in the health center. If the health of the residents is your utmost concern, then test, regardless of whether it is required. So that's a great question, and we've talked a lot about testing. We, up to a couple of weeks ago, had been testing weekly for how many months, Margot? 2. We had been testing every week for 2 months up to like 2 weeks ago. So we were required to do that, which we wanted to do. If you have an outbreak status, which is 2 or more, you have to test weekly on all residents and all staff. Once you go 14 days without any new case, if you have less than 2 cases and you go, or is it 0 cases? Yeah, so less than 2 cases for 14 days, you only have to do monthly testing. That is what's required by the state, and that's what they will pay for. We would love to continue weekly testing, but for those 2 weeks, that was not possible due to the cost. So the good news is we're back to weekly testing. Now that we're in outbreak status, we have to weekly test all staff and all employees, which is fantastic. We got the best results from that. You find it the quickest, and we're addressing it. That's why we have so many cases right now, because the more you test, the more you're going to find that, and that's proven. So we're back to weekly testing, A, and B, the only reason we stopped was it cost $80,000 a month to test just the employees of the health center. If we test the employees each week, 200 employees at $100, that's $20,000 a month times 4, that's a week, $20,000 a week. That'd be $80,000 a month. So that is just impossible to fund. I don't know any community that can fund that. If we would have done that for 3 months, that would have been $250,000. That would have for sure had to been passed on to y'all, and I know y'all understand that, and I'm sure would have gracefully paid for that. But that's something that we can't continue to put a hardship on Springmore. $80,000 a month is just an astronomical amount of money to pay to do weekly testing when they're not needed. So that's why we went to the monthly testing, because the state pays for it. I'm not sure how much longer the state's going to pay, but the good news is we're back to weekly testing. So the question about weekly testing is we're backing in. It's going to be a while before we get off of it, because the amount of cases we have, we've got to go 14 days with 0, and we've got to get down to 0 first. So anyway, hope that explains a little bit. The next question, it was asked that I please address the need for IL residents to follow visitor guidelines. So I ask each of y'all to help me in this effort. I have put out specific guidelines. I'm asking your family and friends and visitors to please follow. They're pretty common. The main thing is checking in at either at the main entrance of either North or South Village, that you're getting screened, you're filling out the form, you're not entering if you have a temperature, you're receiving a visitor's badge, and then you're going straight to the visitors are going straight to their loved one's apartment, staying there and leaving straight from there and going nowhere else. No visitors should be lingering in the hallways, in any common areas. They shouldn't be in any dining areas. They need to go straight to the residence room and leave straight from the residence room. We're even to make that a closer distance, we're asking that they check in at the front and then drive around to the closest entrance for them to enter through there. So we need everybody's help on that. That's something that I know, unfortunately, is just not going to be 100% followed by everybody. But we ask that if you see anybody, to please report to the front desk. The guards do a very, very good job if they're called to go and address it with the person, to ask them to come back down to be screened, or to ask them to leave. And I think it's a mixture of some people just don't think they have to do it, or maybe it's a visitor coming that never got the memo, or y'all never pass it along. And I'm not saying that lack about that, but just maybe it's a friend that you hadn't seen in a while that just had no idea. So I need for y'all to help me with that. I have given it to all of y'all. I've given it to all the family members. We do the best we can to enforce that. So please help me with that. Margot went over the stuff about what to do while in the apartment. We want to be able for y'all to have guests and have family to see y'all, but we really do need to follow those guidelines, which is checking in with all the proper procedures, going straight to the apartment, and then leaving right afterwards, and then following all the social guidelines when you're in contact with your loved one. All right, the next two talk about social distancing in dining settings. The first one says, I'm aware that the dining room in North Village is monitoring safe distancing in the food line. That's good to hear. South Village, unfortunately, is not doing that. I would hope that the issue could be addressed in South Village dining room. Thank you for the consideration. So we are working on that. Again, I need y'all's help with that. We have 485 independent residents and so many staff members in dining to oversee everything. So the staff members know to try to keep people separated and keep the line, but I really need for y'all to help us with that. If you see somebody that is that's bunched up in the line, no need to get bunched up to them any closer, or tell the person, say, ma'am or mister, can you please back up from me or back up from the other lady to give 6 feet. Our staff tries to do it. I know they feel uncomfortable about it because it's your home and it's your decision, and they're not the policeman or the political correctness police, but they are trying to help. But I need y'all's help with that. Y'all just please, it's your home, and we just ask that y'all please follow those guidelines, and that we will address that with staff. We continue to, and I'm asking each of y'all to please make sure you follow those social distancing guidelines, and like I said, call each other out on that too. We're all in this together, and we all need people to help each other, and this is a perfect example of that. All right, lastly, it says, my observations of the dining room in operation in the evening make me fear that we're inviting the spread of COVID there. While the tables appear to be socially distanced at many of the tables, people are sitting shoulder to shoulder and facing each other 3 to 4 feet apart. These are often not people who remain in the same pod, but people who regroup on almost daily. Can you enforce more strict distancing with regard to dining room seating? So when we first opened up the dining room, we're at about a 25% capacity, and we had every table 6 feet apart, which they're still 6 feet apart, and every chair 6 feet apart. That is not required. What's required is the tables to be 6 feet apart, and you can't have no more than 8 people at a table. So our setting's a little different. We only have a limited amount of seating, and we're providing 1,000 meals to residents every day through delivery, pickup, or in the dining room, and we're still at 50% capacity. But the tables are properly social distanced at 6 feet apart. But if you want to sit with 2 or 3 of your friends that you live with every day, that's your choice. I consider this a family. Like she said, that may not be in the same family, but it's the same people you kind of run the circles with every day. If you're uncomfortable with it, you know, you can sit by yourself or ask maybe just for one person to be sit with you. You can do takeout, you can do pickup, but we're following the guidelines of being socially distanced within the restaurant. It's a fine balancing act of trying to provide everybody the services of 1,000 meals, and then trying to make sure we follow everything. So we're doing everything we have to. We're trying to take even extra precautions if we can, but we are properly social distancing based on the restaurant guidelines. Is that correct, Margot? Just wanted to kind of verify that with Margot. So that is all the questions we have. I wanted to mention 2 things before we take some calls. I mentioned this before, and I just want to mention it again. We had to sign up by today, the 6th, of a pharmacy provider that we will contract with to make the coronavirus vaccine available to each of you when it's been specially approved. So we've had to contract with either Walgreens or CVS in order to administer these vaccines. So we have partnered with Walgreens, and we've also partnered with our pharmacy provider for the health center, which is Medipac Pharmacy out of Winston-Salem. So the idea is that they will receive the vaccinations from Walgreens, and then they will come and administer all the vaccines. However, that is the plan because that's who we provide. But that's our provider. But we've signed up for Walgreens as well in case they, for some reason, do not get enough doses, they don't have the manpower, or something happens, they will come here on site and they will administer to everybody that's wanting to take that. The independent folks should be included in that first wave. All the nursing homes are in that first wave. Nursing homes, hospitals, and healthcare workers are all essential workers that will have the first crack at the vaccine. And if our nursing homes will attach to a CCRC, the independent residents will have access to that as well. They tell us once it has special approval, I don't think it's going to go through every single hoop that every other drug goes through the FDA, but once it's reached the special requirements, it will be on site being administered within 24 to 48 hours. So as silly as the Operation Warp Speed sounds, and as silly as that may seem, that is what I know for a fact that we having to sign that, we're having to be ready, and it's going to be here on site whenever it's ready, because we've had to do that. We've been mandated to sign up with a provider that the government's choosing, which is either CVS or Walgreens. So I'm not sure if that's on the news or not. I try my best not to watch the news and just peek at my phone for a second and read things that are essential to my family and work, and the other things kind of fall in place. So anyway, but I'm not sure if they're talking about that on the news or not, but that's the news I read here that helps me care for y'all. So that is true. And the last bit of news, it was an interesting article. I was talking this morning in our stand-up meeting, and I try to just provide conversation or just anything. We always talk about what we're going to do for the day and things we may be doing for the weekend, just provide a little bit of entertainment or enjoyment. And Brad's about the only one that kind of chuckles or talks, and I cut up with Daniel in here. But, it's every morning at 8 o'clock, and we're getting to work, and, especially on a Monday, you can imagine how dead it is. But anyway, so today we were talking, and I was telling everyone about Action Pact, and we're talking about working on the loan for the health center, and Brad gave an update on the construction, which all of y'all saw. We're waiting on the fire permit to be approved, and then we'll have our permits to start working. And the whole point of what I was talking about was that we have not stopped with our neighborhood and culture change model through this whole pandemic, and I thought that was really neat. That we've had people that's been able to stay dedicated to that for us to continue to roll through that, and we'll be starting back our actual staff training the beginning of the year, which we did have to halt. But 10 minutes later, after I got back to my desk, I read an article titled, "Despite Mounting Evidence of Benefits of Non-Traditional Nursing Homes," which we're traditional nursing home, we're a hospital style. Non-traditional would be the neighborhood model, which we're going to. "Redesigns may not happen." So again, the title is, "Despite Mounting Evidence of the benefits of non-traditional nursing homes, redesigns may not happen." And the article basically just talks about how the neighborhood concept in a household is very beneficial to prevent the spread of this virus or any virus. I don't want to misquote this, but it says research shows that residents are 5 times as likely to be coronavirus free than those that live in a typical nursing home. Also says, and 20 times as likely to have survived the pandemic. So the whole idea of keeping people together in neighborhoods and in pods with the same staff and the same entryway and just the same everything, would not have to move people around to dining rooms and to window visits and all this stuff, it prevents the spread of any virus. It could be the norovirus, it could be the flu, it could be C. diff. So these neighborhoods have very, very huge benefits to them, in addition to just all the social aspect. It helps the spread of any type of virus. And then also says that most nursing homes that now they're all interested in wanting to do it, but now they don't have the means to do it nor the time because they're concentrating all their focus on COVID, which we have honestly done. It's been our life for 8 months, 24/7. But also that they don't have the funds to do it because they've had to spend so much on PPE and testing and all this other stuff. So we were very lucky to already be in this process. We already had Brad hired as our strategic projects manager to make sure this has continued to go. We already contracted with Action Pack to keep that rolling. We already had a nice supply of PPE. We continue to build on that every week. We've had funding from testing from the state. So we've been able to still continue our construction and design for this non-traditional nursing home model, even through this pandemic when so many have not. So many have not. They said that less than 25% of the people that had projects in motion to do before COVID have now stopped. So we're we're 1/4 of the group that's actually continuing to do that, and we're very lucky and very blessed to have that. So I just thought I'd share that. That's just kind of a neat little article today, and all this goes hand in hand. Like Margot said yesterday, I think, or today was the state record high of coronavirus cases. I think yesterday was a national high for coronavirus cases. So as I said in every memo, our cases are a direct correlation to the second surge we're seeing. And as you can see from me and Margot, and hopefully from everybody else, we're doing all we can to prevent that in the health center. I'm so thankful and so proud of y'all for not having any cases in independent living. That's absolutely amazing. I don't even want to say it because I don't want to jinx anything, which I guess I just did, but it's been absolutely amazing with 485 residents to not have anything yet. So anyway, we're doing the best we can. I hope that helped a little bit. Hope that answered some questions. I'll continue to update anybody on anything that they need to know about, and please know what we send y'all is accurate and is clear, and we try to get out as fast as we can. So with that, we'll see if there's any questions, and we'll do our very best to try to answer these, and hope y'all have an awesome weekend. Yeah, so the question is, where is the new isolation unit? The isolation unit, the second isolation unit is on A Hall upstairs in the health center. So our first isolation unit was A Hall first floor, so now it's on A Hall second floor. So there's just a mirror image of each other, and the employees use the stairwell up and down the A Hall, up and down first floor and second floor to care for the residents. So they're completely isolated off between those two floors, only on A Hall. Okay, so I'm going to let Margot answer this. This is where I sound like Roy Cooper, and I'm going to convert to Dr. Mandy Cohen because he never knows all the answers, just like me. So the question is, with more nurses and more CNAs being affected with the virus, what is the backup staffing plan?
So we do have a couple of options. One, we do have several PRN or as-needed staff members and part-time members. But one of the things that we're looking at, and you can also see it posted on the CDC website, but there are plans when doing critical staffing that you are able to use positive staff members with positive residents. So if staffing got to a critical level, And we have staff members who are asymptomatic and feel fine. They just have tested positive and they're still within their 10 days. They can work the isolation unit with the positive residents safely. And again, like Brandon had mentioned, we do have a separate door that is off of that stairwell to A Hall that people will come and go. So that is one of our options for staffing. Okay, so the question was, are nurses wearing N95 masks? So an N95 mask is a specifically fitted mask that hospitals use. It requires a certified or licensed person to come and do testing to make sure that it is fitted properly. You can't just buy an N95 mask and it provide the protection that they state it provides without having the fit testing. So the short answer is no, they are not wearing N95 masks. They are wearing what's called a KN95 mask, and that's what I'm holding up here. It does provide a more fitted, a more tight fit around your nose and mouth. The KN95s, without going into a lot of detail, were basically the Chinese version of N95 masks, but they haven't been through our FDA and medical supply testing, so they can't be called N95 masks. But they are more protection than a regular procedure mask.
I want you to address CNAs as far as the staffing issue may come to, but you did not address CNAs only.
Same thing.
So the question was addressing the CNAs. I guess if we have any staffing shortages, we have more CNAs than we have nurses. But we also have, there are some home health CNAs that are still coming into the health center. And also, one thing that is kind of helpful is by the time we get the result, and right now the turnaround time is about 48 hours, an essential frontline worker is only required to be out of work for 10 days, provided they don't have a fever and their symptoms have improved. They can come back after 10 days out. So by the time we get the result, it's already been 2 to 3 days. It's already been 2 to 3 days, so the most they're out is about a week. So far, we have not run into any problems as far as being able to staff. We have 3 restorative aides who are also GCTs, and they do get pulled from their normal duties to fill in for patient assignments.
What's the process to know when a patient or COVID positive resident is released from the isolation unit or health center? What's the process to know that they won't spread it from that point?
So the best thing that I have to go on here, and the question is, how do you know once you release someone from the isolation unit that they're no longer spreading it? And the best I can go on is the information that the CDC gives us, and that's where the whole 14-day quarantine came from, or isolation came from, is 14 days.
You know, and another thing that I learned, and Margot well, I know she can, not me, can talk more intelligently than I can on this, but there's been times where we have kept people in the isolation unit for more than 14 days because they still had symptoms. So even though they were past their 14 days, our medical providers felt like they would still benefit and were still displaying symptoms, that we kept them on there before they were released. So that's something that we do on a case-by-case basis. Is that right, Margot?
Yes. Yeah,
so,
that's correct.
Yeah, so 14 days is the minimum, but it's been but we have several times we have went longer than 14 days if they have not perked up or still showing some symptoms.
Yeah.
Okay. As far as entrances and exits, why aren't more of those closed and guests forced to go to the front desk for check-in?
So the question is, why are not more of the entrances closed and locked off so where visitors have to go to the front entrance? because we're trying to progress with where we're at from where we were, just like everything else. We never completely locked down all of the secondary entrances and made everybody go in the front door. For quite some time, we had the sensors turned off to where you had to pry the door open and pry it shut. That was to deter people from going in and out, but they still went in and out. So as things continue to get better, y'all are obviously doing very well with y'all's cases in independent living. Again, no positive cases amongst 485 of y'all. Quite some time ago, probably 4 months ago, 3 months ago, we turned the sensors back on, and we have asking everybody to come to the front entrance. We're a very unique community. We're not like your mom and pop place or a place down the road that has one big grand entrance to get in and one grand big entrance to get out. We try to make this like a home for y'all. That's why we have different entrances to get to your home faster. So that's why we're asking you and begging for you to tell your family and friends to please go to the front door, to please check in, and then they can come to your apartment and everything will be fine. So again, we can't shut this place up like a prison and make it a prison for everybody when we need everybody's help to go into the front door. So I don't mean to sound harsh on that, but this is a unique situation. So they were shut down for a while, but we decided not to completely close those off. I think that's been good. It's proved us well so far. So I ask that you please just help me and help the staff with guests coming through the very front and not coming through the side door without being checked in.
Speaking on that, can you address that guests that were visiting the villas and homes need to be checked in at the front desk as well?
Yes, so we ask that anybody visiting anybody, even if it's the villas or houses, that they please check in at the front desk. They get their temperature taken, they do their proper screening for them, and they're given a visitor badge. The whole idea is to make sure we know who is on campus at all times. So if a housekeeper goes in to clean somebody's apartment, they see a guest in there without a badge on, they're supposed to leave and go call security to ask the person who they are, why they're here without a name tag on. So yes, even if they're in houses and villas, and I understand that's a little bit more luxury, you don't have to come into the building, which is good for everybody, but we still need to know who is on campus, and we ask that you please have your guests sign in and follow all the same guidelines that you would within the big house, as they call it.
Are the home health aides crossing over between supportive living, health center, and IL?
I'll answer that, I think. So the question is, are the home care aides crossing over between supportive living and independent living in the health center? They are no longer doing that. Is that correct? I just want to make sure, yes. So they're no longer doing that. At first, so we've had to flip-flop on this back and forth. So originally, early on, they were, and then we had to stop it as we had our first surge of cases. We couldn't cross them back and forth because that was kind of cross-contaminating them, and that was not the best thing to do. As we went many, many weeks without any cases or very few cases, many people were needing home care, but we couldn't provide it to them because we have limited number of staff to only work in independent living or the health center. So as our cases dwindled to very few to zero, then we opened that back up to let them go back in between the health center and in independent living to help serve our residents that needed that help. But once the cases went up again, we've cut that off again. That had nothing to do with the cases, but once they did come up, that's just another extra step that we take to prevent the spread. So no, they are not crossing over anymore.
Can IL residents get tested on site?
So I'll let Margo answer this. The question is, can IL residents get tested on site?
So right now, that's not a service that we can provide. The testing supplies that we're using and the billing that goes along with the testing we're doing now is connected with the state testing. And we did put another nurse in the position of testing coordinator because we're doing on average, last week we did the most tests we'd done in over 2 months, and we did 335. And right now, the the 200 the 200 staff members or over 200, and the 100 residents is a full-time job for that one person. It hasn't become a necessity to where we have the resources to go out and test, one or two people here or one or two people there. Being in the independent community, you have more resources than the folks in the health center do as far as free testing and drive-through testing, your physician's office, urgent care offices. So right now, just based on manpower and how big we are, we're not able to offer testing to the IL residents at this time.
Okay, so we got one more question, and that's going to do it for the day. It's been awesome questions. My gosh, thank y'all so much for submitting these. These are great. I really hope this helps everybody. It's just a good forum to just try to get these things out so everybody knows. And everything that I send to y'all, I send to all the staff members as well, so they're on the same page. So just trying to keep everybody up to speed. So what we got here for our last question? Okay, yes, so the comment was North Village exercise room, that a lot of people are not wearing their mask. I will address that with Carrie, and if that continues to be an issue, we may just have to shut that down. Those are the things that I do have control over, and we don't want anyone in there not wearing their mask. Now, I say that, when someone is exercising, I'm not sure if they're required to wear a mask. Oh, there are too many people in there at one time. Okay, I got you. Yeah. So I had to think about that. So normally when somebody exercises, like me all the time, you can tell with my physique here, I exercise a good bit. Absolutely none, unfortunately. So we can't have so many people in that exercise room. There should be a max capacity sign up there. So they should be following that, but I'll have Carrie keep a little closer eye on that. I do know when exercising that it's not safe to wear a mask when you're breathing hard. But yeah, we will address that. I'll address that with Carrie. Carrie stays up to date very close with me on all this stuff, and she does a good job of trying to keep things fair and balanced as far as providing stuff that y'all need and want versus keeping everybody safe. So North Village exercise room, we will address that for sure. So. All right, thank y'all so much again. Margot, thank you. Margot is awesome. I have said it 1,000 times. If you ever want to commend somebody, and she's so modest, she's trying to get up and leave, or give somebody Employee of the Year, it's Margot times 1,000. She has been amazing, and she has been a real godsend. I thank God for her every night. I really do. She is absolutely awesome, and she's helped us. And we got a great team trying to take care of everybody, and please know we're doing all we can. And continue to ask questions. Just be mindful of Margot and her time, of what her main duty is with the affected people in the health center, caring for them. And if you think this is beneficial to do these forums every once a month or something for a while, I'm sure Margot would not mind doing it. I wouldn't mind doing it. So we'll reevaluate that here over the next few weeks. If it's something positive, just let me know, okay? All right, y'all have a great weekend and stay safe. Thank you.